want to say thank you for coming on to talk to us regarding being an advocate for patients. For really, it really extends more than just patients because we're advocates really more for family and friends because they need the information more than the patient does. And I gave you a little bit about me. I've been an inpatient case manager. I've been a nurse for 38 years. And as I tell my students, I'm also an adjunct instructor. As I tell my students, and I tell other people who want to have a clinical group or who desire to teach, and they say, I don't know enough. I said, when you teach, you learn. So it is
Mhm.
an ongoing process. You don't have it all. You don't have all the answers, but once you teach, you learn. So I like picking up little nuggets, tidbits that I can pass on to other family members and friends, neighbors, whoever call upon me. And when I heard you speaking, I think it was last week, I was like,
Mhm.
wow, I need to talk to her. I need her to talk to my audience. So if you would go ahead and get started, introduce yourself, I would appreciate it. And I have
Okay.
questions if time allows. Okay.
Okay. Well, thank you for having me.
You're more than
Um,
welcome.
my name is Carol Campbell, and for those of you who are old enough, the Campbell like the soup. I say that.
Yes, and that's how I spelled it, babe.
I don't know. The young people don't know about Campbell soup.
No, they do. I think they're more into the Roman noodles, something I've never
Yeah.
tried.
hmm But we grew up with television commercials, and they just stream everything. They don't see these commercials.
No, they don't. They don't. They don't. They do not.
Anyway, so again, Carol Campbell. I am a board certified patient advocate. I am a caregiver coach. I am the co founder of Leave the Light On Foundation, Inc. It is a caregiver support organization, a 501c3.
Okay.
And I am also a host of Carol Campbell Coaching Caregivers with Music. And I just want to start off by saying that I have a love for nurses because my whole journey in starting to help caregivers came because my mom was ill. And so most of us, have these stories about taking care of someone.
Mhm.
And so my mom was ill and she was in different facilities. And the nurses were the ones that were giving me that information that I needed that you talk about, educating yourself as you go through it. And I'm going to tell you something, especially nurses of color
Mhm.
they were looking out for my mom, looking out for me, and telling me how
Absolutely.
to get around the system and how to make sure she was okay.
Mhm.
And in this hospital, don't sign that DNR. You might be able to do it in some other hospitals, but in this hospital, don't sign the DNR because she
Mhm.
won't get any services. So I was getting a lot of great love and support and education from the nurses. The nurses, I have so much love for nurses.
Mhm.
Mhm. So, you tell me, do you have any specific question or you want me to go on a little bit more about my background?
You can go on with your background and then I will add to what you just said about the DNR.
Okay.
Um, and now the hospitals that I have, and I'm sorry, I jumped ahead. The hospitals that I have worked for, just because the DNR is written does not stop care. And I've worked for several hospitals in the Birmingham area.
Mhm.
We never took it that way. The doctors never took it that way. Especially, it just means that we weren't going to escalate any
Mhm.
care, but we weren't going to stop anything. We weren't going to put people on pause because people walk in and tell you, "Oh, I'm a DNR," So if they're walking in
Mhm.
telling you that, that means that they're not quite either don't understand what that means or they're not
Mhm.
quite ready on the other side. But we always gave the same amount of care. Now, and they can change that at the drop of a hat. And we often have that. One day they're DNR, one day they're not, one day they're DNR, one day they're not. So they have to really say, don't code them, and it's, I know it's do not resuscitate, but
Mhm.
if point of what it is, yeah, we still give care. We still give care.
Mhm.
We don't escalate it too high, but
Mhm.
when you have that family that's kind of on the cusp of not sure what they want to do, you need to take it. You just need to take it all the way. Um,
Mhm.
and then, what they said is better to ask for forgiveness than to ask for permission. That way,
Mhm.
you're covered. You and the hospital are covered because it's not just going to be uh, you. You know, everybody needs to be covered legally with what's going on. But no, if please,
Right, and I don't want to give the impression that DNRs are a bad thing.
yeah, no, you
I,
didn't, you didn't.
I, okay.
I just
Yeah,
have
because
heard that in the past from other people. I'm like, where they
mhm,
were.
right,
That's not how that's supposed to go.
exactly. And
Hmm.
my mom was in several different facilities, and it was really only one facility where that was the case.
Hmm.
And a sister nurse, I'm gonna call her sister nurse.
Absolutely. Go ahead. Yeah. Be
She
comfortable. Be very
she was
comfortable.
just on point. She would just pull me to the side, or she would call me. And she was, I was very clear that I was not to reveal my source of information. And
Absolutely. No,
so she
you don't
protected
want to.
me, I protected her. Mhm.
Sure. Yeah, you don't
Mm,
want to bite the hand that feeds you and take care of you. No,
mhm.
that you don't want to do, especially when people are advocating for you and your loved one.
Mhm.
No,
Exactly.
you don't want to
Exactly.
do that. I feel as though sometimes I've been on the cusp of having administration call me down. I would have said the same thing I said upstairs that I would have said in administration. Um, but the advice I gave was legal and it was appropriate. But I gave more than I know some of my coworkers would give.
Mhm.
But
Mhm.
for you to make that best informed decision, I think you need to have it.
Right.
I think you need to have that information. And to this day, I don't have any regrets about it. Not at all. Because you have to be ready or as ready as you can be
Mhm.
to
Mhm.
accept whatever decision there is. So yes, there's always going to be, uh, as the phrase goes, a ram in the bush.
Right. Right. And so there were just so many nurses that helped me out through that period when my mom was ill. And
Hmm.
like I said, they were educating me. And so as I was going through this process of just kind of managing her care, I learned a lot. Now, simultaneously, I was teaching an adult education course, and it was getting certified medical administrative assistants certified. Um, and so I already had that base knowledge, you know.
Sure,
But I learned so much more through, managing mom's care and all these nurses and social workers. And, they would literally just pull me in and say, okay, this is what's happening. This is what they're going to tell you, but this is the truth. This is what your mom needs. And I remember the first time a social worker said to me, your mom's Medicare, her 100 days of her Medicare coverage is about to expire. So we need to go ahead and start an application for Medicaid.
hmm,
And I was like, what?
yes.
Okay, well, like, what are
Yeah.
you talking about? Like, I was
Hmm.
completely clueless. As much as I was teaching Medicare and Medicaid, I didn't know about the 100 days, right? And I
Guess when I
find,
found out
when did you find out?
yesterday? Well, not yesterday, a couple of days ago.
Right.
I
The average
did.
Yeah, the average person doesn't know.
No.
You just think you're on Medicare, it's going to cover it. What's the problem?
Hmm.
Um, so for those who are listening and like, what are you talking about? Basically, like, so if you have a loved one who goes to the hospital or to a facility, the the clock starts, day by day, right? If your loved one is still there, at day 95 or day 90 or whatever the case is, Medicare at 100 days is no longer going to pay for it, and so it has to
No, no,
switch over to Medicaid
no.
if
Hmm.
if your loved one qualifies for it, right? So Medicaid is for um, low income. Someone is beyond, below a certain income level,
Absolutely.
right? And so they only pick you up if you fall within that income level. But now, if you happen to have, a couple of houses and, you don't even need to have a couple houses. You have one house and
Yeah, you only
a
one.
decent savings account, you suddenly don't
Hmm.
qualify.
No,
Uh, mhm. So I learned all of these things. And so, for your listeners, this is something that you want to pay attention to as well. You want to make sure if you think, because most people who don't qualify actually need it, you know,
that's true.
it's just that they're just a little bit over that threshold, you know. But don't panic because you still can get the Medicaid. It's just that you have to go through a process called the spin down, right? And what were you going to say? Hmm.
I just said it hurt my heart when you said that because I went, yeah, you got to spend down, and I just told someone this past week. They don't
Hmm.
like you to have no more than 2 grand in the bank,
Right,
and if assets need to be transferred, they should have been transferred 5 years prior. But who thinks about that?
right,
You know,
right.
I've learned that several years ago, and I was kind of brokenhearted when I heard it. I'm like, man, you've worked for this, you've done this, and now you want me to do what now?
Right.
And this is when I was a young nurse. And the social worker, like I said, you have to have a bond with people. Just learn as much as you can learn. Even as a healthcare provider, it's not that easy.
Hmm.
And what really kind of sticks in my craw is when a person tell me I have good insurance. Well, that means nothing.
Hmm.
That just means nothing. It means you're insured,
Unfortunately.
but it
Mhm.
is. I tell people your insurance is limited. That doesn't mean that you have carte blanche to have and do whatever needs to be done. And the people who what is it that have I have Blue Cross Federal, and I'm like, what does that mean? I have insurance with the federal government. I said, what does that mean? I still have to run it to see if you're real, if it is okay. Are you
Mhm.
eligible? you know, they just think that's carte blanche, but it is not. All insurance have a limit. They have a cap to what's going to
Absolutely.
be done, and it's comical. Someone told me this patient, I have the same insurance that the president has. I said, which president? Like, I need to find out where you were. And she said, the president of the United States. I said, did you have to pay a copay when you came in here? Well, yeah. I said, I'm sure the press does not have to pay a copay. Okay, so
Right.
you're not on his level, boo. Please, take
So don't get confused about that.
So it's those little nuggets that you're
Mhm.
surprised to hear, but you have to still educate along the way. That doesn't make it carte blanche for you. You know.
Right, right, exactly. And
Hmm.
so, especially if you're talking about long-term care, right?
Absolutely. Hmm.
Excuse me, even if you're talking about at-home care. So,
Yeah.
well, just to go back, so I'm not jumping all over the place, we're talking about that spin down. So if you're taking care of someone and they're over that threshold of having assets and money, um, like you were just saying, Carolyn, you have to, it's called this look back. So you can't, if you say you have $50,000 in savings, right? Excuse me, or your mom who you're taking care of has $50,000 in savings, but you know that that's not going to go a long way in terms of her long-term care, and you apply for Medicaid, they're going to say, well, there's $50,000, so you got to use that $50,000 toward her care before we kick in, is
Hmm.
basically what they're saying, right? You can't just say, well, we're going to give it to her granddaughter and her niece who needs help with her son. And, you can't start giving it away to people who need it. Now, that makes sense to us.
It does.
If
It
someone
does.
else in our family needs it, let's give it to them.
Hmm.
But how the system works is the spend down has to be applied to the loved one, to the patient.
It does.
Right.
It does.
So if you're going to spend $50,000, it has to go through the to the long-term care or the at-home care or it could go to an elder attorney who's working on paperwork for you. It can go to a
Hmm.
patient advocate, but it has to go towards services for that patient. That's the spin down. Yeah.
That's great information. Great
Hmm.
information. Because a lot of things people think they can transfer that fund, and I tell them, no, there's no, we can't transfer. You know,
Hmm.
it's non-transferable.
And when
And
people say, when you hear that term 5 year look back, that means
mhm,
that that can't be done within 5 years of the illness.
true,
So even if you say, "Oh, mommy's getting really sick right now, and so let me start spending down now," and then she needs the long term care within a year. Medicaid is still saying, "You know what? It was only a year ago that you started doing this, so
true,
it
true.
doesn't really apply."
Hmm.
you know,
It doesn't.
right? They want it to be 5 years out that you started like dispersing money to family members or whatever. That's what that 5 year look back. Um,
And that's great information as well because people think, well, I can just transfer it, put it in my account, and everything will be okay. And I'm like, it doesn't work that way. Well, I'm sure it will. And when they give me that type of statement, I say, oh, okay, then, because you have to back off because you can't make people receive that information. But when they get it from the source, um, then they were like, well, you tried to tell me, and all I can do is try to tell you. I can't make
mhm,
you receive the
mhm,
information. But that
mhm.
is good information for people to know.
And it's hard. Sometimes you got to send, especially if you're talking to like, I'm a patient advocate, but sometimes my own family members or close friends can't receive it from me. You know,
Oh, no, they
you
can't.
know, I could
I'm
talk
there.
to, you
Raise
know what I
my
mean?
hand. I'm there.
Hmm.
Yeah. Hmm.
Right. Sometimes you just got
Yeah,
to send them somewhere else so they can hear it from someone else.
I agree.
So whoever, they know. They just need to go somewhere else and get that information, but be proactive in it. And I've worked with some families who have been actually very proactive. And when, like, one mother turned 70, and in this one case that I worked with, when she had turned 70, I think she's like 85 now. But when
Hmm.
she turned 70, this mother went ahead and put her house in her daughter's name. And
Hmm.
she wasn't sick, but she just based it on if she were to need, you know, Medicaid. She said,
Sure.
and she looked at her family and how, how long they lived and when they started, like her siblings and her parents, and she just kind of, and said, well, most of us live till 85, 90. But cousin such and such and cousin such and such got really sick in their 70s, so I'm just going to do this at 70. And so that's you really don't hear that often.
You really don't. You really don't. You hear about the fight, but you don't hear about someone voluntarily transferring their property to someone at a certain age. I mean, it is a good idea, and I tell my family members, the patients' families, when they bring that subject up. Well, I tried to get mom to sell the house and come live with us a few years ago, and I was like, yeah, she refused. Oh yeah, her and dad both refused. I said, well, that's all you can do is ask. You can't make them do it because they raised you in that home, they raised your sibling, they purchased that home so that they would have somewhere to go. And they're going to dig their heels in and refuse to go. So it has to be their decision. And that's when they said, so you've heard this before. I said, quite a few times I have heard this before.
Oh yeah. And listen, there's so many different dynamics in terms of family, how family handles finances and care and the whole thing. And so every family is unique, as I say. And so if you have a family who, not responsible or not as responsible for things like, sometimes parents have adult children who have made really, bad decisions. And so that they can't, they don't feel comfortable handing things over to them or turning things over to them in that way.
I agree.
And so every family is different in terms of what decisions they need to make. But when I work with caregivers, I say to them, it's okay if you can't, if this is not something that you need to turn over to your adult children, but identify someone, you know, identify it could be cousin, it could be, the daughter of your best friend, it could be, but just find someone. And sometimes you can go more professional services, and look for representations, legal representations, for example, to handle that estate for you. Um, but yeah,
I
there's. Hmm.
there's no one case that fits everything. So,
Hmm.
there are different dynamics, and you have to approach them. But they don't really, a lot of times, now I'm not I'm an advocate, but I'm not a coach. Uh, you just, they don't always give you all the information immediately. And that's fine. They're giving you bits and pieces. So when you make suggestions, how do you counter that? How do you deal with that?
Right. So when I'm coaching families, I'm actually getting a lot of times when I talk to families, I'm getting a lot of information because I've kind of set it up whereas we have our first session where we're just talking. You know what I mean? And we're
Sure.
talking about dynamics and we're talking about your relationship with your mom. Listen, there are people who have to take care of dad, but dad used to molest them. Not to get grim, but this is the reality of we don't know
It
what's
is the
going.
reality. It is the reality.
Yeah, and so I usually delve into, what's the background, talk to me, because where, standing from the outside, you think it shouldn't matter. It does matter, like what type of relationship you had in the past, and whether you, as an adult child, can handle this responsibility, or have you ever gotten, therapy for whatever the issues are with you and your parent, or if it's a wonderful love fest, are you too emotionally, can you not make decisions because you can't even think about putting mom somewhere else, or what's happening to her, and so maybe you need someone that's more neutral because you guys are like best friends, so it goes from one end of the spectrum to the other. But to answer your question, yes, I just kind of deal with each family caregiver one on one. I get all the background information. I understand their personalities. I understand their ability to manage finances, how to stay organized. Uh, you know, a lot of times people are just not. Um, they don't understand the lingo. So I try to speak in layman's terms all the time. I try to talk to those people who won't talk to the clinician because they feel like they're not smart enough, or they don't really know what to say, or they don't understand, or they'll just say yes to everything and they haven't understood a thing that they've been told, you know. And then they forward me the information, then I break it down. And so just a process of creating a relationship with someone so that I can coach them through what needs to be done next. Mhm.
Yeah, that is so true. Now, have you ever had a situation where they appreciated everything you said, agreed with you, basically that their loved one was going to need long-term care after the hospitalization, and they were going to step up and do what they needed to do? You try to let them know the nurses are here 24/7. Now, who's going to be at your home 24/7 to assist you? And they still insist upon caring for their loved one at home. How do you deal with that?
Um, I don't get a lot of that. I get a lot of I get a lot of like of exactly what you said. Oh my gosh, how am I going to do this? I can't do this. Um, Once in a while, I'll get someone who believes that they can do it themselves, and sometimes I have to just let them try. Because I can say, I always tell them, you're going to need help. You're going to need help. I always tell every single one. And I also say, because sometimes someone will be discharged from a hospital and the family members are clueless of what to do next. And I say to them, you should have had a discharge nurse and a discharge plan. And so what I'm finding is depending on the location and the lack of personnel, uh, sometimes that process is being skipped over, or families are given a list of people to call, like here, where before, so it depends on the hospital, the city, the location, the hospital, right? You can get a total discharge planning and a nurse navigator and the whole thing, and they're walking the families through, step one, two, or three, and four, and helping them and making sure that they have home health coming into the home, and the whole. That's the perfect scenario. Other scenarios, depending on the hospital, like I said, they're just kind of shoved out the door and given a list and telling the family, "You handle it." Um, and so, with those, if I do have a family who feels as though they can handle it by themselves, I try to remind them, like you said, listen, there was 24-hour care here at the hospital. You're not going to have that. You need to sleep at some point. Um, and so I've been helping caregivers for what is it, about 13 years now.
Okay.
And I'm going to say I can count on one hand where I had people who really felt like they could do it by themselves. But you have to understand, if they're coming to me, they understand that they can't do it by themselves. So that's probably just not my target. You know what I mean?
Sure.
Um,
Sure.
but I know that they do exist. Those people do exist where they feel as though they can handle it. But again, I think that my advice for someone who's trying to help someone or trying to convince someone that they need help is, try your best, give them the information, and just let them, you know, go through it for about a week, and then they'll realize that they need help and they'll reach out. They will. Sometimes you can't force things, people just have to step through it.
No, you can't force. And
Mhm.
we give as much information as we can.
Mhm.
Well, we give as much information as it's needed. And I've had um, the family member to tell me and the doctor, "Oh, I can do it. We'll do it." And we were like, "You're going to need help. You're really, really going to need help." And here's a list of agencies. Maybe you have some family. Just call, check around. No, I'm going to do it all by myself. And I'm like, okay. And the day before discharge, she finds me. I can't do this. I got to keep my grandbaby. I was like, whoa, wait. This is the discussion we've been having with you for at least 7 days now. And here you have changed your mind, which you definitely have that option. But we could
Mhm.
have already worked on a lot of this 7 days
Right.
ago. And so I went and spoke with the physician, and she said, "Are you kidding me?" I was, "Oh no, wouldn't dare kid you about this, doc." And she dropped everything she was doing, and she went into her and she told her, "Now we could have had this done. We could have had this done. You talked to us 3 different occasions because we had a meeting. It wasn't just we spoke at the bedside. We had a nice, comfortable meeting room, and we discussed
Mhm.
it." And she was like, and she said, "You never mentioned a grandchild. We told you you would need the help. Now we can still put a discharge plan in place, but you should have been more forthcoming with us."
Mhm.
And
Mhm.
that's really it. Just be forthcoming. And like you say, there's some family members that aren't forthcoming with their family members. So you just have to be ready to pivot.
Right. Yes. Yes.
You
That's
have
the
to
perfect
be
way to
ready.
say it. Yeah.
Because the job still has to be done. And me, if the patient has been assigned to me, I want to feel comfortable that they will be okay at home.
Mhm. Mhm.
I want to be comfortable with that. Or wherever they desire to send them. So it's still challenging at best. Now,
Now,
when go ahead, Carol.
no, I was just going to say that there are some family members who actually can handle the bulk of the care, like they physically can handle it, but they haven't factored in um, needing a break, or they haven't factored in, going to the grocery store, like the basics. They just haven't factored in. They're just thinking about, can I handle the care? And some family members are really good at that personal care and the daily activities and the whole thing, but they just haven't factored in everything else. And then that's when it starts becoming overwhelming. And so, perhaps they just need a break. And so then in that kind of situation, what I do is make sure that they are um, talking to their family members or neighbors or church members, etc., so that they can have that break. Because in that case, that's the only time that they actually do need help. So that they can have someone come sit with mom for, 4 hours while they go run errands or just go get their nails done or whatever the case is. They just need a little respite. Mhm.
And that's true. Now, that brings me to a question.
Mhm.
Who can get respite and when?
Okay, so the broad term of respite, as you know, is just take a break, right?
Yes.
But I think you were referring to the more formal term of meaning that someone is actually um, providing a respite for them. Is that what you mean? Mm.
Yeah, someone who's not on hospice. Someone
Right.
who's, someone who's, you're just caring for your loved one at home. You're coming home to them every day, caring for them. How do they get respite other than with a family member? Is there an agency or is there rules and regulations that apply where they can have some respite care?
Okay. So there are, look, first of all, Medicaid does provide that. But you have to qualify that. So if your loved one has already qualified for Medicaid, then there are programs in your state that give respite to caregivers, right?
Yes,
There's also, if you are taking care of a veteran, there are a caregiver respite programs under the VA. If you there are organizations that actually specifically take care of respite. So now some of this respite, it can go either way. It could be someone coming into your home and caring for your loved one so that you could take a break. It could it could be that you qualified for your loved one to go into a facility for a weekend or for 4 days or a week while you travel, and then that's taken care of. So these programs exist, but they are very state specific. Um, and so I always say, I always direct people to the Office of Aging and the Department of Aging rather. And people always say, well, such and such, I'm taking care of my husband. He's not a senior. Why am I going to the Department of Aging? Because it's kind of a catch-all, and it's very broad, but then it's also very state and county and city specific. And so you can literally, so like for example, you're in Alabama, right, Carolyn?
yes, I am.
So if you were to just Google Department of Aging Alabama, um, I believe in your state it's going to say Department of Senior Citizens probably.
Yes,
And so, but
yeah,
if you just use that, any state, if you just use that term, it's going to direct you to the exact department. And then you just click on it and then you click on resources. And depending on the state, it's literally going to take you straight to whatever you need, right? Uh, so if you need respite, it's going to direct you to nonprofit organizations. It's going to direct you to Medicaid. It's going to direct you to Veterans Administration. Such a great umbrella, and I always direct people to that because it will cover not only senior citizens but those that are disabled and other aspects as well. Uh, but respite is very, very important. I think a lot of people, especially a lot of people of color, I think we as a community have been taught to struggle, 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 and it's okay to struggle, 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 but it's not okay.
it's not okay. It is not okay.
Yeah.
It's,
It is not weak. It is not a lack of faith. It is not, you need a break.
I agree. I
Um,
agree with you 100%.
mhm,
But you used that magic term when it came to respite, Medicaid.
mhm.
So if someone who does not qualify for Medicaid and still
Mhm.
needs respite, how do
Right.
they navigate that?
Right. So there are various caregiving organizations, there are churches. It's hard for me to say without a specific case. So this is what I would do if I'm coaching someone. They would tell me where they live, right? And I literally go to, like I said, the Department of Aging and just look at all of the respite services. And sometimes it's an organization you've never even heard of, right? And
True.
it could be an organization in that county where that person lives, and that organization is working with 50 different families um, who have farms, let's say, and they are offering, a bed and breakfast to caregivers to stay for weekends for free. You know what I mean?
Yes,
So there are just like so many, it's just countless things that are actually out there that people don't know about. But it's usually kind of state or county specific. And it's just that people aren't looking, they don't know where to look. And that's how I usually get most of the people that I work with because they really don't know. It's exhausting, really. You're already trying to take care of somebody. Now you're trying to figure out, where this so-called respite is, you know?
yes, absolutely. Yes, yes,
Mm.
I can
But I
understand.
would say the key I would say to the average person is to, start with your family. But you know your family better than we know your family.
Yeah,
So listen, if cousin, James is going to drive you crazy, don't call cousin James. You know what I mean?
yeah,
So, but you know who's in your family that can help you. We already know that. We already know who the top three people are, and we know the other three people that you don't even want to call. So, let's be smart. Let's be smart about it. If you are blessed enough to have at least three people in your family, or even one, um, that can give you a break, you're going to start there. If not, just then widen your circle. Then it's maybe friends, or maybe it's a church family, et cetera, et cetera. If you cannot figure it out there, then you're really going to look, like I said, to the Department of Aging, because they're just going to have like this umbrella of different organizations and different places. And there's other things that you can Google, like, there's tons of caregiving organizations that would have listings, but that state is going to give you stuff that's specific to your area.
okay. Now, you mentioned the VA a little
Hmm.
while ago.
Uh-huh.
What resources? And we know you have to be a veteran. Let's put that disclaimer out there. You need to be a veteran.
Hmm.
But what services can they potentially receive by being a veteran?
Right. Okay. So the veterans, and of course, I go straight to the caregiver, but the veteran has all types of services, right? So, but if you're taking care of someone who is a veteran, there's like two routes to go. So, one route is if the veteran has like a service um, disability, right? Service connected, I think that's the term they use, service connected
I think
uh,
you're right. I've heard that term, service connected. Hmm.
disability. And simply that just means that whatever problem that they have is started when they were active duty, right? And even
Yes.
even if it's much worse now, it's just like the beginning stages of it. Now that list is much bigger now. The current administration kind of uh, broadened that list now. Before you have to really come up with something major, but that list it actually includes high blood pressure, right? Diabetes.
Right.
It includes things that are pretty common now. Um, anyway, so it has to be service connected. And so for caregivers to get the financial part of it, okay? So, and I'm starting with financial because, a lot of people just need that help, but there's other services as well, including respite. But let's just say you're taking care of Uncle Joe, and Uncle Joe was determined by the VA to be 75% disabled, and it's service connected disabled. So he needs help with his routine of getting dressed and bathed, etc. Excuse me. So because of that qualification, you can now apply for a stipend, right? So they will pay you monthly. It depends on the region you're in. So you're going to get paid. You may be doing the same thing for your Uncle Joe in Mississippi that someone's doing for Uncle Charles in California, and you want to know why, um, your friend in California's stipend is much bigger than yours in Mississippi, it's because it's regional, right? And
Mhm.
it's cost of living, right? So obviously, if you are renting an apartment with for Uncle Joe or in Uncle Joe's outside of LA, that cost is going to be skyrocketed versus maybe a small town in Mississippi, right? So it's regional, it's cost of living, so the stipend's going to differ depending on where you live. Excuse me. But anyway, so you can go online, you can call the VA, you can go to your local VA and just get an application. If you're not savvy online, just stop by your VA, the one closest to you, and get an application. Or you can go online and fill out the application online, and they will tell you if you qualify or not. Okay, so that's one support that you can get from the VA. Another support is, like I said, that they do have respite programs for if you're taking care of a veteran. Now, I believe, to double check it, but I believe that these respite programs are not necessarily have to be service connected, but just that you're taking care of a veteran, right? They were active at some point, they're a veteran now, and you're taking care of them. And then you can go and there's a kind of caregiver support program that gives respite. They give counseling as well, therapy. You could be taking care of someone who has been, has some psychological issues, PTSD, and they have a lot of, flashbacks and outbursts and things like that, and that's affecting you, right? Could be affecting
Absolutely.
you mentally, and so you
Mhm.
need therapy yourself, right? The VA provides that. They provide that. So there's just,
Okay.
several
And
different
that's
support.
great to know. That's great to
Mhm.
know as well, because sometimes you think you're out here on this ship by yourself.
Mhm.
Um,
Mhm.
and because you do need a mental health break, especially when there's different levels of care. It's different when someone's in the bed and unresponsive or minimal responsive as to someone always trying to get out of the bed, always trying to walk without their walker. That's emotionally draining for the caregiver.
Mhm. It
That's,
is.
yeah, but
It
because
is.
they're moving quicker, faster than the patient. So that's good to know that they can receive some care as well.
Mhm. And then there's also these benefits called beneficiary travel benefits. So let's say you are taking your husband, who's a veteran, to appointment after appointment after appointment after appointment, right? And people like forget about these little, they're not little things, they're huge when you're going through it, but like the cost of gas, you know what I mean?
No, I've never thought about that. But yeah, that's great.
Yeah. And so the VA, they have benefits for that as well. So
Hmm.
all this is you can call, the VA, you can stop by their offices, you can go online and just, say I'm taking care of a veteran and I need help, and they will walk you through it. They will definitely walk you through it. Mhm.
One of my family members, not my personal family member, when I speak of my family members, I'm speaking of my patient family. She called me one day and she said, they have a policy. I said, well, what's the policy? You don't ask, we won't tell you. So it's like, I was not expecting that, as you can see, and I heard it but didn't hear it. It had to kind of come back around, and I
Mhm.
was like, "Wow!" And she said, I'm sitting here waiting on people to direct me and tell me what I need to do, and because I don't know, so you don't want to be too pushy. And she said,
Mhm.
but you don't ask, they won't tell. And so now they're telling me, I don't have to stay the whole day with him when he's getting this, that, or the other. I can get a free ride back. And she said, I wish they hadn't told me this 2 weeks ago. So
Mhm.
it's things like that that means a lot to people because loved ones do want to be around when their family are having tests or different things of that nature. But she said, this is an all day thing. And they told me I don't have to be here. Once I get him here, I could have left. And she said, she said, so if you don't ask, they won't. I was like, whoa, what was me? And when we had this conversation prior, when I reached out to you, you and I both agreed. I mean, and anyone else would as well. But if they haven't been through it, they don't know it. If they haven't worked in it or haven't been a part of their life, you don't know. And it's
Right.
this topic is so expansive. I mean, it's so very broad. So we're just trying to give the listener an overview of what is out here, what to look for, what to do. Um,
Right. Right.
yeah,
And
you
I
know.
would say if someone is listening and they're not a caregiver right now,
Mhm.
I would say, be intentional or proactive in finding, or if you know a caregiver to help, you know.
I agree
Um,
with you. That's another reason I want to have this conversation, um, because it may not be your situation now, but at least now you can help yourself in the future or someone else. You can
mm-hmm.
pass this information on. It's not for you to hoard. It's not for you to keep. It's for you to learn from. And
Right.
maybe you won't have to go through the waiting stages or the pitfalls if they don't ask. If you don't ask, they don't tell. Um, and don't I always tell my patients and my family members, when you go to the doc, take a pad and a pencil before you go. Write
Mm-hmm. Mm-hmm.
down your medications or have your list of medications with you. And I know things are computer generated now. Take that with you to whichever physician you're going to. Write down when you had this exam or when you had that test done, this procedure done. You're your best advocate. Instead of
Mm-hmm.
saying, oh, it's in the chart, I come here all the time. But if it's in the building A and we're in building C, you know, sometimes there's a delay in getting that information. But if you
Mm-hmm.
have it on you, then there will not be that much of a delay. And if there are questions that you have, I often tell them, write your questions down. So when they come in the room, I don't care if you're inpatient, outpatient, whatever, write your questions down. Don't sit up and talk about the ball game. Don't talk to the doctor about the ball game when he comes in. It's okay to be polite and if you want to ask him how's his family. But you are the patient, you're in need of care, and you need to get answers for what is going on, what the expectation is. And I said, if you have your list handy, your list of questions, just make sure you go down that list. He doesn't mind answering your questions.
Mm-hmm.
He or she
Mm-hmm.
does not mind answering your questions, but they can't ask what you don't answer. I mean, they can't answer what you don't ask.
Absolutely, absolutely. And if you don't think that, you might have a diagnosis that's really a cancer diagnosis or something that's really emotionally draining on you. You just feel like you can't think thoroughly. Have someone with you
I agree.
um,
That's
who
another
can
thing I ask them to do as well.
who can ask those questions, just like you were saying.
Hmm.
Um, so, like you and I would go in as a patient, and we have our paper, and we and we would
Absolutely.
be ready. But
Uh,
everyone is not capable, and so you need to bring someone with you and have
hmm.
them ask that question. And the other thing I'd like to say also is is accessing the patient portal. Like I know the older that we get, or generations that are older, are not necessarily, you know,
Tech
on the
savvy.
computer or tech.
Yeah.
That's what I'm looking for. Yes, thank you.
Hmm. No,
Tech savvy.
yes. Hmm.
And so, but that's okay. Get your niece, get your nephew, get your whoever to pull up that information for you, because all your information is right there on the portal, right? It's a computer program that's connected to your doctor's office or to your hospital, that has all of your records, your medications, what they say about you, the whole thing. Um, and sometimes you will have doctors or nurses or whoever's putting the notes in, they may have missed something because depending on who that clinician is, like you'll have a clinician who has a laptop with them as they're examining and they're putting all that stuff in as it's happening. Other clinicians may work to the end of the week to do all their notes,
Sure.
and they have forgotten half of what you said. You know what I
Woo.
mean?
Yeah,
And we're not,
absolutely.
and, I'm not,
No, no, no. People are human. They are
yeah.
human.
Yeah,
They're
so you
still
don't know
people.
which person you have, like, when they put their notes in, and so
Absolutely.
you need to be proactive and checking and making sure you say, "Oh, he never talked to me about that," or,
Hmm.
"I remember asking him this, and he didn't even mention this in the notes," and so you have the ability to respond, um, you know, and again, if you don't feel tech savvy, get someone. We all have somebody else. Like I said, we all know who's around us and who can do what. So create your team and utilize them.
True that. I had a cousin that worked for a government agency, and our big thing is when we would talk, and she was like, I was like, well, what about this 80-year-old grandma that doesn't have a computer? Well, she knows someone who does. Well, I guess that and it wasn't an argument. It was I would go to her on a fact finding mission, just like
Mhm.
she would call me on a fact finding mission, and
Mhm.
then we would go off into another realm of care. And her thing was, who cares for people when there's no one? And
Mhm.
I was like,
Mhm.
there is someone, if they have to appoint a conservator or if they have to appoint a guardian, because you do have that patient or that neighbor that has outlived all their relatives.
Mhm. Mhm.
You know,
That's true.
I mean, I've seen it, and it blows your mind to think about that, but it does happen. And
Mhm.
you have to get legal involved. You definitely have to get legal, especially if they're in the hospital. We had to get legal involved, and the wheels start turning from there. And she was not on her deathbed. She was sick, but she was not on her deathbed. She got better, But at that point in time, that's where the conservator and the guardian comes in,
Right.
so
Right.
they can speak for her.
Mhm. Mhm.
It's so many caveats out here.
There
Um,
are there are there are, and we also, when we talk about other people helping, if you're someone trying to figure out how you can help someone, step in and do that. Be their tech person, or or be their driver to appointments, or be their, whatever it is, kind of step in, because like you said, that there are those 80-year-olds or 90-year-olds, or other ones who don't have family anymore, and they need the help. And if it's not going to be someone legal, it could be all these people out here trying to figure out how they can help someone. That's how you can help. That's how you can.
Absolutely. That is
Hmm.
how you can help. Especially not just helping yourself to put your name on their bank account, but
Thank you.
you should see the things I've had to break up in the hospital. But I'm
Oh my.
yeah, yeah, they bring it to me, and that's definitely outside of my scope of practice what goes on outside, but they bring
Hmm.
it to me, and I'm like, well, and sometimes even having that power of attorney does not give you carte blanche to a lot of things.
Hmm.
Because they would come to me and say the bank didn't recognize this, and I was like, I can't control the bank. I mean, I can't control that.
Well,
Um,
I'm glad you bring that up, because I find often having to explain this to people, that power of attorney, there are two sections of power of attorney.
mhm,
So one is medical power of attorney,
mhm,
and one is financial power of attorney. And so a lot of times people are signing this medical power of attorney thinking it's going to handle everything. And like you said, it doesn't. Right. So when they try to go to the bank or make sure that the social security check is going to the facility, because mom now has to go into the facility, they can do nothing with that medical power of attorney, because they didn't sign the other section, which is the financial power of attorney. So that's something that they want to pay attention to. Hmm.
absolutely.
Hmm.
And what about the dual
Hmm.
power?
And that's dual. That's dual, having
That
both
includes
parts.
both, correct?
Mhm, mhm.
Okay. And
Yeah.
what about a trust?
Right. Now, I'm not an expert on that, but I
Yeah,
do know that there are
I know
trust
what I'm
funds.
saying. As it's coming, I'm thinking. That's all.
Right, right. There are tools within the trust, within kind of a state tools, where you can put your house, for example, in a trust, right? So now the trust owns the house. You don't own the house. So when it comes to Medicaid, and you're now applying for Medicaid um, for long-term care, when they do the look back, it's not you. That look back at your asset isn't there, or your $50,000 isn't there because it all is now in the trust. And so that's one of the things. Now, I don't know exactly how that works, to be quite honest with you. I always send people to, the financial experts for that. But I know that once you move things into a trust, then that means that you no longer have it. Um, but your family members have access to it.
Okay.
hmm Yeah. So it's definitely a tool that people use,
Mhm.
um, even just in the world of real estate as well. Like if someone is going to pass away, they don't have to, if it's in the trust, they don't have to go to probate court to try to fight over mama's house
Okay.
because
You know what's
because
gonna
it's
happen. It's going
r-
to happen.
right.
Well, 9 times out of 10, there are some people who can be amicable, but oh, those nine, mm, that
Yeah,
nine,
it gets so messy, and then I
it
always
does.
find as well that there's an extended, especially in my experience with some of um, people of color having like this extended family members, if you will, right?
Mhm.
And so you already have the siblings having problems, right?
Yes.
Trying to make decisions for mom or dad or grandma, right? But then you have these other influences of, the cousin or second cousin or third cousin and nephew, other this, and then everybody's chiming in. Um, and sometimes, it's hard to decipher because just because you have the title of nephew, let's say, your relationship may be more like a son to your aunt, right? Because your aunt really raised
True.
you,
True.
right? And so we have a lot
Mhm.
of that dynamic also. So it just gets really, I just say that, if you have something like a living will, um, that's really going to break down everything for you in terms of what decisions you want made, who you're depending on, who you want to make decisions for you. Healthcare proxies is a simple way to do that as well, because there's times that an adult child will come back and say, "I'm the child, I make the decision," but meanwhile, the niece is the one that was actually, you know, more more of a daughter,
Absolutely.
you know.
Mhm.
So, yeah, it just runs the gamut when we come to families. Just you have to be very specific about what's going on in your family to do the right thing in terms of caregiving and patient advocacy. Mhm.
And that is so very true. I ran into, well, the situation ran into me where the friends brought the patient in, and I was just forced to receive the information from the friends. But when we found or when the family members appeared, by virtue of HIPAA, we could not speak to the friends again. And it is heartbreaking.
Mhm.
But they were like, we're like family, we're like brothers, we're the ones who brought. I said, I get all of that. I promise you, I do. But now that next of kin has shown up, I can't. They can talk to you, but I can't anymore. And
Right.
it's because of the Privacy Act. And they
Mhm.
understood. But yeah, I'm broken hearted because I wouldn't have received all the information I had if it had not been for them. Um,
Right. Right.
and and then to have to shut them off like that. But it has to happen. It
Mhm.
has to happen. It's nothing that you want to do, but it just has to be done.
Right,
Um,
and so that's the federal state laws under HIPAA, and but I mean it can be contested in cases of extreme neglect, I guess you would say. It
Absolutely.
can be contested in court, if
Mhm.
someone is really like if a adult child has is really abusive or something to that effect, and there's a really close family member, and if you have evidence, et cetera, then the judge in usually probate court can grant guardianship to someone other than the next of kin if there's enough evidence. Um,
Yeah,
but
absolutely.
usually, yeah.
Now, Carol,
Hmm.
um, how do you stay up to date on these policies and regulations?
um, well, I'm like part of like everybody's newsletters from the government to advocacy groups to everything, and I'm constantly taking classes and certification classes, etc. So I literally wake up every morning and spend an hour, or two, just before I get my day started, just reading, like, these alerts that I get about a new policy, about the new, um, what the VA is doing, because I'm on their email list, and I'm just constantly reading and learning and taking courses to keep up to date on everything. And then because of my work, I have to research something. And so then as I'm researching, I'm learning more as well. So it's just an ongoing learn fest for me. And I absolutely love it.
And it shows. It definitely shows. And when you have a passion for something, it's not like work. You build on what you already know. You build on your base,
Hmm.
and you can share and put that information out. Um, there's a senior living book that they gave us. We had a bill that we could get from the hospital, and I would give those out to families when they had a lot of questions. And I always kept one for myself. And now I need one, so I think I have to go to the hospital and find it because I haven't been in the hospital in a while, in
Hmm.
several years now. So, but that doesn't stop, and I'm okay with people asking me questions. Honestly, I am. I'm thankful that they feel confident enough to do that, and I will let them know where my knowledge stops and where they need to find some knowledge, someone who's more
Hmm.
knowledgeable than myself, and seek that information. um, so once we are out here to family and friends, we're forever out here to them.
Right. Hmm. Hmm.
Yeah, we're going to be the go-to person. And like I said, honestly, I do not mind. Honestly, I don't, because when people are reaching out to you, they want the help. They
They
may not
do.
like what you
Hmm.
say, the results of what you're saying, but they know you can't control the results. But they want the information, and I'm willing to give it.
Hmm. Hmm.
Yes,
And I also want to mention before we end
yes, ma'am.
that I really appreciated at the beginning. I'm not sure if that part recorded or not, that you opened with prayer. Um, and I just want to talk about how important that is. And, I'm not advocating for any one religion.
Sure.
Um, but I'm saying that there is a higher being and how important that acknowledgement is in patient advocacy and caregiving. I know as a board certified patient advocate, we are actually tasked with making sure that we are learning the importance of spirituality and prayer and understanding different cultures and religions, et cetera, so that we can respect it and include it as necessary. And there are literally scientific studies that talk about the effectiveness of prayer when it comes to healing, et cetera.
Do that. True.
Yeah,
Hmm.
yeah. And so I just want to say how important that is in the journey as people are going through, um, illnesses and healing, et cetera. And I want to thank you for including that in your podcast.
That is my background. I'm not someone to throw the Bible at you, but that is, I grew up primitive Baptist. I have been in church, basically all of my life. That has been the glue that has kept me, the stability you need. And when I first got my first nursing job, I was an LPN for 5 years. And even after I became an RN. Every day as I drove to work, my prayer was to be alert to my patients' needs. I didn't want to bring anyone any harm. I just want to bring them help and be alert and astute enough to catch any changes that they had, and that I could, give that to the physician, because we are here to help and not to hurt. And I did that every day, going to work
Mhm.
every day. And
Mhm.
I will confess, when I started working on the phone, I'm like, well, okay, Lord, okay, Lord, I thank you. Not that I don't need you, I thank you, but the needs of the patients that come through the phone do not change.
Mhm.
So
Mhm.
you have to have that base, that support, to help you to do the job that you do. And you are correct. There are scientific studies that speak to that. Your spirituality, you have to have a sense of purpose. You have to have a sense of purpose. And I have worked with physicians that have told me, um, told the patient, I'm just a vessel. God is doing the surgery. And I like that. I
Mhm.
absolutely love that they're humble enough. I've seen them pray with their patients before surgery. So, that kind of helps strengthen you as well, that you're not in this fight alone of praying with your praying for your patient. And I know, I like they say, keep one in your pocket, because someone pulled. One time I walked into one of my units, this lady ran out and just grabbed me. Come in here, pray for him right quick. And I was like, right now? I was not expecting that. And I was like, well, what's going on? And she said, he just don't look good. And she was the daughter, but it just lets you know you never grow old when it comes to being a child and your parent. And so I did. I said a quick prayer for her strength and whatever was going on with him. Because I just walked in the door. So that is my foundation. That is my basis. And I just continue to thank God for it, because you have to have that with what we run into mentally with being healthcare providers, and working with patients and families. You need it. You really do.
Mhm.
You just need it.
You
I know. So
definitely do. Yeah.
and I thank you for that. I thank you for that. And I don't think it did get recorded, but we're going to close in prayer as well, because you want to be alert and astute enough to continue to speak to families and friends, family members, friends, whoever is calling out for our assistance. And you may have to repeat it 3 or 4 times, not the prayer, but the information that you give them, because they're so overwhelmed they cannot hear.
Exactly. Yeah. Exactly. Yes.
Yeah, they cannot hear. So thank you for that. Thank you for that. Thank you for that. But I do appreciate that. Now, do you have any closing remarks? Any additional closing remarks?
I would just say, I mean, it is. I'm not sure if we mentioned this, but it is National Family Caregiver Month. And so I would encourage, whether you're a caregiver or you know a caregiver, I would encourage you to support, either get the support you need or support someone who is caring for someone. Often it's a silent struggle, and people smile and say, I'm fine, we're good, I'm fine, we're good, but they need help, they need support. And so if you know someone, figure out a way to help them. And if you are a caregiver, go ahead and reach out for that support that you need.
And that is true. That is very true. Don't keep that, because if you don't say, they won't tell.
Right.
You don't ask, they won't tell. So you do have to let people know. You don't have to carry that burden by yourself. Um, you don't have to be the epitome of strength. You don't have to always be. It's okay. It's okay to cry. It's okay to walk away. It's okay to take a breath. It's okay. Because I tell people oftentimes, because you always have that person. Oh, if I was them, I'd do this. If I was them, I'd do this.
Hmm.
I said, I don't. This, what do you think? I said, I never criticize the caregiver, because I'm not there. I'm not in their shoes. They're doing the best they can. And I leave
Mhm.
it right there. I leave it right there.
Yeah,
There's
that's a
no
good
missing.
practice to have, that's for sure.
Yeah, because we can all sit in that peanut gallery and just throw out
Mhm.
what we would do. And I know some of these people, and they would not. No, no. And I'm
Mhm.
glad you mentioned caregiver month. I was aware of it, honestly, I was, but it keeps slipping out, because I guess because we have a month for everything now, just about,
Mhm.
but
That's
not to
true.
negate anything, not to speak anything negative on anyone. How else will you get the recognition if it's not out here?
Mhm. Mhm.
Yeah, and caregivers do need to be recognized. They
Absolutely.
definitely be recognized. And Carol, I thank you so much for your time and your attention, your knowledge. Um, how can people reach you?
You can reach me. I'm on Facebook and Instagram, probably more Instagram than Facebook. And I also have a website that's campbellcaregivercoach.com. So they can reach me there. And then also I have my nonprofit organization is leavethelighton.org, leavethelighton.org. So they can reach me any of those places. And I would also encourage people if they just want some nuggets of coaching without having to leave their home or call someone, you can tune into my podcast, which is Carol Campbell Coaching Caregivers with Music. Uh, and so it's not actually music. What it is like give various information or kind of coaching caregivers through certain subjects, and then they take little breaks with music. So the
Okay,
last episode
that's great
I
because
did
I was
talk
going
about
to ask you about. Yeah,
spirituality.
I was going to ask you about.
Yeah.
I'm
So
sorry. I
I was gonna say
apologize.
that's
Explain
okay.
that to me just a little bit more, if you will.
So like my last episode that I recorded was about calling your A team, and when I say A team, I mean your alpha, your angels, your ancestors, and your advocates. And so it's more of a spiritual type of episode where I talk about the need of prayer, etc. And then I'll take a break, and then in the break I featured BB and CC Winans, right? So like talked about like the your alpha, whoever you call your alpha, right? We talk about that. Then I take a break with one of their songs, and then we talk about angels and how it's listed in all holy books, the presence of angels. And then
Mm-hmm.
take another break with BB and CC Wine. And so it's almost like a radio show where you talk and then you have music and then you talk and you have music. It's like that. But yeah, so I've covered topics like how to, the things you need to do if you're caring for a difficult loved one, right? Or a very independent loved one, or children that are another episode where about children who are living in the house with you as you're caring for someone who's very sick, right? What you need to do for those children. And with that episode, I used the Jackson Five for my musical breaks.
Okay, great.
So. So it's fun. It's a fun way to kind of break up sometimes a conversation that could be a little draining.
Mm-hmm.
Kind of break it up with a little music. Yeah.
Okay. And be the light. Tell us a little bit about that.
Okay, so Leave the Light On Foundation. So the name of it is because, when we were growing up, my brother, sister, and I, our parents would always say, leave that outside light on, right? If
Mm-hmm.
we were coming back lately, leave the light on. Did you leave the light on? It was just constant, you know,
Oh
or
yeah.
leave the inside light on so it looks like somebody's home, you know. Um, so it was like a constant phrase in our home. And when my mom got ill, one of the respite things that I did was take an art course, and I painted the house that we grew up in, and I named the painting "Leave the Light On." So it just stuck. So after she passed away, and I thought about that, that one of the things that stuck with me was that 100 day I talked about, not
Mm-hmm.
knowing what that meant. And I
Yeah.
was like, how do people figure this out? How do people know this? And I said, you know what? I talked to my sister, my brother, and I was like, you know what? We need to start some type of foundation or something to help people with the basics. And so that's what we did in the end of 2010. started this foundation. And so it's basically just giving people information about caregiving. And we also help, we get funding to help people with utility bills, kind of like literally leaving their lights on, right? Uh,
Absolutely.
and then we've done a series of events where we either, like, we had pampering days where we bring in massage therapists and estheticians and manicure pedicure technicians to just pamper, caregivers for a day. And then we've had other dinners where we would honor caregivers for their work, for what they've done for family members. And so that kind of, slowed down during the pandemic, obviously. So we're in a process of kind of getting that started back up again. But yeah, so that's what we do with Leave the Light On Foundation. And my work is with coaching and advocacy. I kind of do one-on-one, so people can contact me if they want to work with me in that realm. And if you need some help from our foundation, you can contact me with that leavealighton.org as well.
Okay. Well, thank you for that. And I apologize for calling it Be the Light, but you have been a light because you have enlightened us.
Aw.
You have, knowledge truly is power. So
Mhm.
I do appreciate you again. And I did want to you to speak regarding um, your podcast that you intertwine with music, because music is soothing. It can be very, very soothing. And
Oh,
sometimes we're so
absolutely.
tightly wound, we forget about
Mhm.
the little things in life that can bring us down.
Oh, absolutely. Just putting on that music and just moving around a little bit can do it.
It can. It
It
really,
can.
really can.
Yeah.
And I think that's where walking, when things get, I try to walk often, and sometimes I walk out of frustration, and sometimes I walk out of need. But when I come back, I feel better. Because
Mhm.
any of it can be stressful. Any of it can be stress. Life can bring you stressors. But thank you so much for being a part of Gentry's journey. Um, and thank you for giving us your time and your talent. Um, with the Leave the Light On, you truly have been the light for me today, and I do appreciate that.
Oh,
If
thank
nothing
you.
else, you're more than welcome. And if nothing else is said, then I will close in prayer. Lord, for those who are caregivers to friends and family, may they feel your love and your sustaining power. May they feel less frustrated and experience less guilt for just being human. Lord, we thank you. We thank you for opportunities. We thank you for Carol. We thank you for all the caregivers that's out there, families and friends that are standing in the need of some support. Lord, these and other things we ask in your son Jesus' name. Amen.
Amen.
Okay, well, we're going to close right there unless you
Okay.
have something else. And I really
No,
do have
thank
a.
you for having me.
Oh, you're more than welcome. You're absolutely more than welcome. And you have a good rest of the evening, okay?
Okay, you too. Take
All
care.
right.
Bye bye.
Thank you. Bye bye.